Good morning. Unfortunately, I'm not speaking French, so if those who need the English, put your headphones on. And I wanted to first start out by giving a little bit of my perspective, my background. I am a teacher. I'm a teacher, a professor at the University of British Columbia, but I was a teacher of 7th and 8th grade and of high school for at-risk adolescents. How many of you out here are teachers? Raise your hand. So some, I can't, it's kind of dark. I'm also a parent, and I'm a parent of two boys who are Gray, who is 11, and Griffin, who is 15, just turned 15, who teach me a lot every day. And how many of you are parents? Okay. So, wow, a lot. So I wanted to tell you that my own background and experience over the past couple of decades is really trying to figure out the way to educate the heart. How do we promote these positive human qualities like empathy, compassion, altruism, and also how do we prevent mental health problems? And that's really what my focus will be on in this presentation, and linking it to other parts of this as well. So one thing that we know for sure is social and emotional learning is important. Why? Because teaching and learning actually have strong social, emotional, and academic components. They're inextricably linked. You cannot take apart the social, emotional from the academic. How kids feel affects how they learn. And as one former student of mine who was a teacher said, would tell his students, you learn the most when you feel the best. And so that idea of how it is learning linked together, of how children feel. We also know that emotions can either facilitate or impede learning. Have any of you ever had, just those of you who are parents or worked with children, any issues around motivation? You know, trying to get kids to do things and realize how emotional laden that those, how kids feel, whether they can do things, whether they say they're smart or they're dumb or they don't get things or they throw up their hands. And this always affects school success and how much children learn in schools and how they feel about school. But so why now do we need to be concerned about this? In my field, I feel this idea of really focusing on children's social and emotional health in schools is really rising to the top as something that people are more and more concerned about as we hear about bullying, as we hear about suicide and things. But what are some factors now? Well, we know, for instance, that there's a number of changes and challenges in our society that are happening that weren't there as much as before. We know, for example, poverty is on the rise and that many children live in poverty and arrive to school without having breakfast, without proper sleep, and a number of different factors that affect their learning that are real important. I believe in Canada, 1 in 5 children live in poverty. We also know that our society is changing, and children who used to be raised by the village and had extended family members is now really different. So there's a number of things that there's a loss of support of extended family members, of neighborhoods and communities that would support children in previous years. We also know that children, I don't know any of you who have ever heard of if your children go on the internet. It's just amazing to me, my son who's 11, how he can just go, how he talks to his friends on Facebook and post things on YouTube, and it's back and forth, and it's just amazing to me. But what's happening is that, there's a loss of these role models that happen often because there's so many things that are out there. We also know there's exposure to violence, and I'll refer back to the video games, even though a child here is watching TV, is that there are many more games and violent games and things that children are exposed to, and even on TV, lots of exposure to violence. And finally, we know that about 1 in 5 children have experienced problems severe enough to warrant sort of clinical applications. And we know about 1 in 5 have some sort of disorder. The leading disorder is anxiety. And we also know only about 25% of those children get the services they need. So something is really amiss here in terms of what we're doing. So I'm going to talk in the next couple of minutes about a growing movement called social and emotional learning. And Dr. Paulus mentioned this before when he talked about CASEL, the Collaborative for Academic and Social and Emotional Learning. And this idea that we need to promote children's social and emotional learning skills to the same degree we need to promote their academic achievement in school. So we know that social emotional learning is the process where children learn to manage their emotions, care about others, have good relationship skills, and all those kinds of things, and sort of avoid negative behaviors and negative health behaviors. And have any of you heard of the book by Dan Goleman on emotional intelligence? He wrote that in 1995, and that was really a focus of that. Now, social and emotional learning reflects 5 different dimensions, as reported by CASEL, an idea of self-awareness, social awareness, self-management, this idea of self-regulation, relationship skills, as well as responsible decision-making. And what we find is that here's a model that's used, and it's sort of like the one Dr. Paulus used before, is that we find out that healthy relationships, classroom management, instructional support all lead to the dimension of these skills. But I want to call your attention to a couple of things up there. At the bottom, it talks about school and community context, district, state, and federal policy. But look at the top, and this is something we haven't talked enough about, is teachers' social and emotional health and well-being. How much do we talk about the teachers in terms of helping them recognize what's important and be able to have their own well-being? And if they're going to help the children, we should first think of them. We know that social emotional learning, I'm not going to mention all of the countries, is a movement happening across the globe, all across the world. These movements of social and emotional learning and programs and practices are around. We also know that in recent years that SEL, or the social emotional learning, fits within a paradigm shift of rather than focusing on just the ill-being, but focusing on well-being and resilience and looking for a strengths-based approach. So, for example, we now know that optimistic people, you know, those people who wear the rose-colored glasses, who see the glass half full, who are somewhat delusional, actually are happier and have better health outcomes and live longer, better relationships. And we also know, oh, sorry for that, I skipped through one. We also know there's a whole new paradigm focus on neuroscience, and we know, I just heard a statistic, 90% of what we know about the brain was learned in the last 10 years. And we know things like neuroplasticity, as well as this whole idea of the prefrontal cortex that regulates emotions. And so there's a lot of information feeding into this. So what do we know about the effectiveness of SEL programs? We know that many programs help prevent things like substance use, interpersonal violence, bullying, and school failure. Just recently this year, published a meta-analysis, a study of many, many different studies that looked at 213 school-based programs of almost 300,000 children in kindergarten through high school. They did an extensive lit search, and what they found, and this is published in Child Development earlier this year, was that they found that children who were in programs that had a focus on social and emotional learning in their classrooms versus those children who were not, the control group, that children in SEL programs actually had better social emotional skills, better behavior problems, were more likely to be positive about school, but they also showed that those children had 11% percentile points higher in standardized achievement test scores. And so it really just shows you it's a twofer, meaning 2 for 1. You not only promote children's social emotional well-being, but their academics. And of course, they decreased in conduct problems and aggressive behavior. So what can we do? How can we nurture this idea of social emotional learning's growth? I like to always give this quote. I don't know if any of you have heard of Yuri Braun from Brenner, and he talks about an ecological approach. But one thing that Yuri, I really like his name, really said was this idea of every child needs someone in his or her life who is absolutely crazy about them. And so I want to start and talk about the importance of relationships, how important relationships are in promoting children's social and emotional health. Second, there are a number of programs out there, and I want to talk about Roots of Empathy, a program on which I've been doing research for the last several years that's now that's in Quebec. It's translated into French and is in many countries throughout the world as well, that brings an infant into the classroom as a springboard for talking about emotions and how we get along with each other. Another program that's from Australia that's being used across Canada as well is called the Friends program, which has been focused on anxiety reduction. Again, another evidence-based program. And finally, another program in which I've been doing research is something called the Mind Up program that incorporates something called mindfulness, positive psychology, as well as social and emotional learning. And that program has been very well received in North America, actually, and it's in the UK as well. And finally, one of the ways to nurture SEL's growth is to incorporate it into teacher training. And I think the last presentation really talked about this. At UBC, at University of British Columbia, we now have a focus as part of teacher education on teacher candidates or pre-service teachers learning about the social and emotional learning and having it infused within their curriculum, as well as approaches that are going to help their own social emotional well-being. And I'm actually doing a study right now for teachers called Smart in Education, Stress Management and Relaxation Training for Teachers. And we're incorporating some of that within pre-service teacher education. Thank you.